Hello, I'm Dr. Neetu. Today I'm going to discuss about jugular venous pulse or JVP. The right internal jugular vein, superior vena cava and the right atrium are in continuity. So the height of the JVP reflects the right atrial pressure. So when a person is placed at 45 degree, supporting his head and turning to the left side, the JVP can be visible along the along the line of the sternocleidomastoid muscle. And the right internal jugular vein is the best vein for the accurate estimation of central venous pressure. And this recording of JVP is known as phlebogram. So in this video, I am going to discuss mainly about the waveforms, JVP waveforms. So there are mainly 3 positive waves and 2 negative waves. If the pressure inside the right atrium is very high, then we will get a positive wave. If the pressure inside the right atrium is low, we will get a negative wave. So the first wave is A wave. That is, A wave refers to atrial contraction. So the blood on reaching the right atrium and the tricuspid valve closes. When the right atrium contracts, the pressure inside the right atrium increases, and this creates a positive pressure, that is A wave. And it occurs just before the first heart sound, that is S1. And this A wave is absent in case of atrial fibrillation. In atrial fibrillation, the atria contracts, that is, the coordinated contraction won't happen. The atria fibrillates or quivers in an uncoordinated way. So the atrial contraction, there is no atrial contraction, so no rise in pressure, so no A wave. And in case of tricuspid stenosis, we will get a large A wave. That is because the tricuspid stenosis, the valve narrows, so the blood faces more resistance while passing from right atrium to right ventricle. So the blood atria has to contracts against a tight valve. So the pressure increases and we will get a large A wave. So that's all about the A wave. Next comes C wave. So from right atrium, blood reaches the right ventricle and the tricuspid valve closes. So the pressure inside the right ventricle increases. So this causes the bulging of tricuspid valve into the right atrium. So this creates a pressure inside the right atrium and we'll get a positive wave, that is C. This is very small and often not visible. Next comes X descent. So in case of X descent, the atrial relaxation and downward movement of tricuspid valve occurs. So when the atria relaxes, the pressure falls. So the decrease in pressure causes a negative wave, that is X descent. So in cardiac tamponade, we will get a prominent X descent. So what happens in cardiac tamponade? The pericardial fluid compresses the heart. So all the chambers of the heart will be in external pressure. So the ventricular filling will get impaired. But in early diastole, what happens in cardiac tamponade? Due to opening of tricuspid valve, the pressure, due to that, the blood will rushes from right atria to the right ventricle. So the pressure inside the right atria falls, and the exaggerated downward movement of the tricuspid valve causes a fall in pressure. So there will be prominent X descent. Next comes V wave. So again, from all over the body, the blood reaches the right atrium. So the tricuspid valve closes, the pressure inside the right atrium increases while the atria gets contracted. And that is venous filling occurs. So we will get a V wave. And in V wave, in tricuspid regurgitation, we will get a large V wave. That is, the tricuspid valve will be incompetent. So the blood will backflow from right ventricle to the right atrium. Also, this right atrium receives blood from the superior vena cava, inferior vena cava. So the pressure inside the right atrium increases very much and we will get a large V wave. So that's all about the V wave. Finally, the Y descent. So from right atria, blood rushes to the right ventricle. When the tricuspid valve opens, this causes ventricular filling, and there will be the pressure inside the right atrium decreases. So we will get a negative wave, that is Y descent. So in case of constrictive pericarditis, we will get a prominent Y wave. That is because the pericardium will be very tight and less compliant in case of constrictive pericarditis. So the ventricular film will get impaired. But in the early diastole, what happens? The blood rushes from right atria to the right ventricle when the tricuspid valve opens. So this creates less pressure in the right atrium, and the wide descent will be prominent in case of constrictive pericarditis. But in case of cardiac tamponade, this wide descent will be absent. That is because due to the compressed fluid compression, the ventricle won't expand in order to accommodate the blood. So ventricular filling cannot occur. So that's all about the waveform. And finally, we can discuss about the important clinical signs of GVP. That is first one, right heart failure, then comes pulmonary hypertension, cardiac tamponade, constrictive pericarditis, and fluid overload. These are the clinical signs of GVP.